Kia ora Mo, and can I invite the panel to come and take their seats, please?
No.
Now, what we want to do is kind of encourage some open discussion, which often doesn't happen at conferences. We just kind of become active receivers of information, but we're really cool. I'm going to ask for kōrero. And Wiki, I know that we don't employ you anymore, but I'm going to ask you to be my runner, if that's okay. Kia ora. So Wiki's going to be our runner. So please put your hand up in the air and wave it like you just don't care if you have a question for the panel. There have some, and this is going to be fun, not a hazing experience for the panel, which I know they are a bit nervous about. So we have got some questions that have come in through the QR code and also on Zoom. So we might start with you. Is that okay? Okay, and then we'll just move this around. It's not like she gets a choice, but I was just trying to sound warm. So a question, and I won't use people's names, but a question that's come in, Sue, is how could those that work, I think especially in Te Whatu Ora at the moment, how could they use the framework on existing services and programs?
Thank you. I think one of the ways is if you know that you're reviewing your service, then you can use the framework as you do your review to think about the questions that you might want to be considering in your review. And you can use the equity assessment tool. When you've decided what it is that you want to be doing, you can use that framework as a way of tool as a way of thinking about what's happening amongst teams and services in your organisation that may impact on your ability to create change in the service that you've got going currently.
A little bit shy out there. So, oh, here we go. Oh, okay, Nina.
Okay, so here's to Laura. How do we make what Sue just suggested happen across our crazy health service?
Do you know what? I was just about to, when she handed me the mic, I was like, oh, I could actually add to that. Thanks, Nina. But yeah, I was just literally thinking we have, so there's ELT, the executive leadership team within Health New Zealand, and under the executive leadership team, we have these things called OPCs, which are like operational performance committee, like subgroups. One of the subgroups is, which has ELT members, but also some key leaders throughout the organisation, is an equity OPC. That's co-chaired by Karen Bartholomew and Rihanna, who most of you would know used to be our chief executive for Te Ako Whaiora and is still the Holder Māori Services Director and sits at that tier 2 level. And I'm just thinking the organisation is still this, well, we're still, sorry, I pause because sometimes you're not sure what we're doing and what we're not in terms of the mandate, but we're still going ahead with an organisational wide equity framework. So that is about looking across the organisation, what are all the equity frameworks and tools we're using, and actually what's our position as an organisation. So I think actually that, and the fact that Karen's linked in, Rihanna, that would be the mechanism to actually get it in the sort of what you call the system architecture of our organisation, and then it's more enabling, it's easier to, yeah.
Can I just add? So obviously we designed the framework, developed the framework and the readiness assessment tool from a Hawara Māori equity point of view. But we think we were very careful in a round of revisions. We were, after some of our consultation, we were and feedback to make sure that actually it could be applicable to other groups that experience inequities. And so, you know, encouraging people to think about other groups that experience inequities and using the framework and the assessment tool for that as well.
There is a question, Maida. There's a lot of people that work in Māori health that are here today. how do we connect those that are at the forefront of Māori health, like what you got us to do during the vaccine clinic, and the research that is currently happening? So how do we do that translation, or how do we, there's been a lot of research at Mahi around working with bipolar disorders, eating disorders, first episode psychosis, vaccine. How do we move stuff from the research environment into support Māori health workers who are at the front of all of this inequity and are trying to navigate with patients?
Wananga like this in the first instance, so getting together. Also, I think there really needs to be, I've been talking about this for years, there needs to be a repository somewhere of information of the stuff that we're all doing, and that is easy to understand for all of us, because we speak in a different language as health professionals and researchers, but those of us who are on the front line in our community don't speak that language. So information that our particularly our Māori health workforce understand, but get together as a repository of information, and relationships are key. I know that a lot of our whānau get asked to be involved in equity groups and for their services, and so how do we get together regularly and share our research and tautoko each other? And I just like to affirm that forums like this are really important, but we should do them more often, I think. Yeah.
And for the Māori, those that are working on Māori health in the room, are there questions? How can we create a bridge between what you're seeing every day and the mahi that we're doing? How do you see that we might create that bridge? Theo? Oh, sorry. Maybe do you want? Can we start with you, Theo? Okay. Oh, yeah, there's two others. We'll go up there. Sorry, Theo and I have worked together for a long time, and yeah, Theo works in the cancer work, and I think there's here at the here on Ōtautahi campus, we have amazing cancer researchers. We've got amazing Māori health workers in cancer, but I'm not sure about our bridge between us. But kōrero mai.
Kia ora koutou, ko Sarah Aho.
Is it green?
Yeah, that's right. Kia ora, ko Sarah Aho. I work for a Hauora Māori partner in our community. For me, it would be about the visibility of our data also in the health system, because it is completely invisible. And that is across quite a few data sets and quite a few, I suppose, service sectors. And even in the presentation today, it wasn't really clear around the Hauora Māori partner component of what we did in our communities. And I know for us at Te Pua Waitanga, we had 44,000 vaccinations go through a Hornby hub. But where is the collective data of our impact for our community? And I think that's where we need to come together, because that will be the change. It's that we are doing good for our whānau. And what you said, Māori setting, Māori healthcare, by our practitioners, and it's been seen, and it's elevating our work in the community. So yeah, I'm really open to working together, getting our data out there to show that actually together collectively we do well for our whānau.
Kia ora, thank you. And I think Kara behind you, Ricky. Oh. Kara, you've worked at the interface of both. Do you want to add to that? Oh, through the mic? No. Right. Okay, kia ora te pora. Oh, can we just get you to talk in the mic? Only so the Zoom people can hear, because I can't hear unless you're on the mic. It's just like karaoke. It's quite fun.
Oh,
yeah.
Okay. Kia ora koutou ko te porai, haua hau ko au te kai whakahaere mo te ropu haora I roto I tēnei hohi pera. But I've been around a long time, and I really enjoyed your kōrero, Maira, because what we do need to do is that we do need to know all the services that are out there, but we also need to be a bit more comprehensive in utilising that kōrero. I've been around a long time, so I started out at Hillmorton, moved over to Princess Margaret Burwood, and then I've come in here. But all of that resource, and knowing all of those systems and that relationship with everybody that's in those areas is really important. The other thing we need to also reconnect with is our providers out in the community. In my early years, we used to have all those hui, and we connected because we all service the same people, and it went around and around. So those sort of things that are practical and doable would be really great. But I also think our Pākehā colleagues in the system need to go back to being comprehensive workers, because that makes it easier for people to move around the services and help each other. Once you specialise, people go, oh, I don't do that. You know, I think we need to get out of that. In this time and climate, we need to be able to be more movable and want to move and change our attitudes. A lot of it is changing the attitude and how we work and be a bit more vital in this time frame. Now, the climate's changing, and to keep up with it, we have to do things very different.
Kia ora. Thank you, Te Pora.
I was going to give snaps for that.
I think that's why my heart lit up when Laura talked about doing a management of change within the budget. I think every work environment we work in at the moment, there's no more money, and actually they're trying to trim. And so it worries me about how we keep doing equity. So you kind of gave me hope that actually we could still do it in the resources that we have. Yeah, thank you.
We've done it over at Kerwood recently, because what happened was, before I came over here, I was already thinking about who could actually fill in my seat. So I started growing her and talking to her. And then we did the interview last week, but it was about increasing the number out there with the budget that we still already had. So it was about what could she do for 30 hours? Okay, the other 10 would go to pick up somebody else who's only on a 0.5. And then we still had a person who was doing 40 hours, and now we also still have an empty 0.5. So it is about being creative within what we have. And I think as Māori, we know we've never had heaps, but we can still be creative and support our colleagues also about thinking differently, because we all need to be taking each other along, because we need each other at this time.
Kia ora, thank you. And so, Mo, the whakatauki that you used, I've never heard that, but it made me think about, you know, how Te Ao Māori concepts really are rongoa in themselves. And actually, so when you talked about doing a glossary, I'm like, oh my gosh, more hard words to learn. But actually, when you explain them, it was so strength-based and hauora-based as opposed to illness-based. You could see how that in itself, as a psychologist, I would approach the way I treated that patient quite differently, because I've already know what the signposts are for hauora instead of focusing on unwellness. In terms of, because you interviewed those whānau at the forefront, and we've got a lot of health professionals here, what would be a couple of words of advice you would give to health professionals when working with these tangata whaiora?
I think a couple of things would be I'm thinking about causal factors for eating disorders, and tangata whaiora are saying that they're cumulative exposure to adversity. So it's not just one thing; it's multiple exposure to adversity, whether it's body image ideals, poverty, and yeah, these are some of the things that we should be looking for when whānau are coming through.
Kia ora, Sue. Is that on? Is that going? Ngā mihi nui kia koutou katoa. Just fabulous to listen to it. It's quite uplifting given some of the stuff we're having to put up with at the moment, Laura? But just a comment perhaps from all of you, and I'm probably more familiar with Maira and Laura, the mahi that you've done. But one thing I noticed with all the mahi that you've had to speak about to us today is it requires us you really at different points in time, I hesitate to say break the rules, but certainly bend the rules in order to get stuff done. You know, Mara, I remember the rules at the Ministry of Health were saying about who could get vaccinated and who couldn't. And you basically ignored them. Mihi just said, yeah, well, hate to pay, we'll stick needles in the arms of anyone who wants a
That
needle
was
stick.
my hearing disability. I
Oh,
just didn't
yeah.
hear them.
Shoulder, yeah. And we all just said, haere tonu. And I know, Laura, you know, with some of that West Coast stuff, there were actually barriers put up by some colleges to prevent some of those docs doing stuff, but they just ignored it and did it anyway. And some of your stuff, Mo and Sue, are saying the same thing. So in terms of that implementation stuff, Sue, sometimes you just got to bend the rules, and you know, what you've said gives us the courage to do that, but we need to continue to push it. Some comments on that, please? Kia ora.
Damn it, I'm first in the line for the mic. What was I going to say? I just think that's part and parcel of the challenge and the opportunity. You know how you can always see things as both a challenge and an opportunity? 100% agree. I think we make or we think we've got these rules. We do have rules, right? Like I'm thinking rural generalism, we had rules from the ministry, sort of rules from medical council. We had the multiple professional colleges who did or didn't want it. I think it's actually relationships as well. You know how some people say, oh, it's about relation. There's some quote about it's not about relationships. It's all about relationships and trust. And what I put in my presentation before, change moves at the speed of trust. And so I do think it's about being brave and having the courage to do what you know is right, but at the same time doing your due diligence so you're not just going random and going rogue. But I do think it's relationships, and I do think it's actually examining things and thinking, is that actually a rule, or is there a way we could get around it? I think that's the biggest thing. That's the thing, you know, we do every day, eh, Hector? Like, how do we get around that? Is that really true? Is that really a barrier? Because then you never change and you get stuck in status quo.
I think that's right. I think as well as bending rules, I think two things. I think in the current environment that we may have to do, and I'm thinking here about equity. Well, no, I'm thinking specifically about Hauora Māori, because it seems to me that members of the government are comfortable about equity for other groups, just not so much for Hauora Māori. So we may need to do some things that go under the radar at the moment as well. And then the final thing is, I think if we're working in trusting relationships with people that may not be as comfortable or as experienced around equity, is actually supporting them to have courage to step into that space that they don't have as much familiarity with as well.
Gosh, yeah, I really tautoko that. So our colleagues might feel really uncomfortable at the moment. We do, and we do need to support each other. It's tough, and we really appreciate you all who do support Hauora Māori advancement. We didn't break rules, Hector. We followed the evidence. We were an evidence-based clinic. But there were heaps of barriers, weren't they? And they were really unnecessary. And we worked around them. But it's too much. The mahi was hard anyway. All that colonial tax, I like to call it, it's unnecessary. But I think, unfortunately, in the current environment, that's going to get even harder. So we need to tautoko each other and, look after each other.
So I've got a couple of questions coming in. The people that are online are writing really hard questions, so let's go for one. How important is collaboration between different researchers, healthcare professionals, and communities in the context of translational research? And what are the best practices for fostering such collaborations? Is that a Sue Kringle question, or yeah?
Well, I think all of the TMFs, theories, models, and frameworks, I think that they have, they talk about stakeholders, and so all of those groups that were mentioned in that question would be critical stakeholders to be part of the planning of implementation pathways, or actually selection of interventions, planning of intervention pathways, and then the implementation and monitoring. And I think it's good, like in a lot of my work, I actually work with quite wide and diverse groups of people, and it's fun. And so I think it's just pulling people together in that context, getting to know each other, developing the trusting relationships, and enjoying what you're doing.
Something to say? No, Carl.
I have a specific question for Laura. Actually, there's a couple, but I'll just pick one, which was, sorry, my technology is failing me. Oh, I think one of the questions was really around, what do you see the role is of allied health professionals in management of change?
Oh, just the same as I'd say any of us, any midwives, nurses, doctors, I think all of us in health are change agents just where we are. We can be change agents wherever we are. If it's in regards to, and I'm just thinking off the top of my head, there's so much that allied health is doing and leading at the moment with some models of care change. Like I'm thinking things like the musculoskeletal pathway. So instead of, you know, when you come into ED, traditionally going through the whole orthopedic doctor medical pathway, actually why are we not using physios within our ED and doing a musculoskeletal pathway? Things like Avastin, you know, our optician colleagues who are in primary care, you know, based out in the community, why are they not doing Avastin injection? Well, they are, but you know, why have we got secondary and tertiary centres having ophthalmologists doing Avastin in an outpatient setting? So there are two things that come top of mind. So I think there's heaps. I think it's actually being able to mobilise and find your friends, like you said, so actually enjoy what you do and get sort of that coalition of the willing together to make the change you need to make. Make the change where you are. Don't think the change is so hard that you can't make it. You can always make change wherever you are and just start there.
Kia ora, and Maira, looking ahead, what do you see are the most critical areas of focus for Māori health research? And how can the lessons learned from your work be applied to those future challenges? It's these online people, they're hearty.
From my work, sorry, Sue.
How can the lessons learned from your work apply to future challenges?
Gosh, so Mo was part of the research team and the vaccination team. So we're going to answer this question together. Yep, sure. Is that better? Going forward, what should we focus on? Wow. What you're passionate about, actually, Suze. Our focus, we're just having this discussion within our department and where we'd like to focus our research, and it's kind of different actually, because we're mostly mental health focused in the department. Now Mo is reaching out and has been actually in contact with Annabelle and is looking into rongoa. Trace is changing her research. She's thinking about real strengths-based, community-based research. So this is a really airy-fairy answer, but I think what you're passionate about, and if you look at the need, it's everywhere, is why I get the privilege to say that. So yeah, and for me, I think probably primary health care.
I'm just going to float this idea here. So earlier this year, I was NHMRC is the Australian equivalent of the Health Research Council, which is the main health research funder here in Aotearoa. And earlier this year, I sat on a cardiovascular disease grants assessing committee for the NHMRC, and I was really impressed by the way they had a series of different grants that you could apply for with the expectation that you might do your clinical trial that is proving if this thing works. And then the next grant you could apply for was the one that assessed kind of implementation in a larger way. And then the third one, which was really big, was looking at scaling up. And we don't quite do that here. But I wonder if that would be something that in the area of kind of interventions, that would be a useful way, and that would support actually the whole translation into practice. And obviously, the Hauora Māori and equity components would be critical features in all of those parts.
And just a quick comment from me, it was interesting, I had the privilege of, when they were developing the national research strategy, Linda Smith couldn't make a meeting and they said, do you want to come? It's like, oh God, that's you really probably do need Linda Smith. But what was really interesting is in the community focus group that was happening, that because the government wanted, like, is it heart disease, cancer, COPD? You know, they wanted a list of really illnesses to focus their research on. What I was really struck by is the whole community said no. They said the most important thing is our health. And one day that might be, you know, working with Tim in surgery, and then the next day it might be actually a more interfacing with cancer research like Logan. And so our community said actually everything's important, because their whānau are all impacted by multiple things and they don't want to choose. And they also didn't really want, when you talked about rural generalists, it actually made me think of this group, because they said the problem with you researchers is you get too specialist and you can't pivot to what our needs are. And they were more keen on us developing generalist skills as researchers. So one minute we can be doing cancer research and then we can flick into cardiovascular disease or surgical intervention, that we had a skill set that actually could match what the need is when it's required. So I think for me, in answer to that question, it's like whatever the community tells us is a priority, and whatever we've got the skill set to do, we need to come together, because actually that's the only way we're going to keep doing good translational research. I think up in Wairoa, when we did our cardiovascular stuff, because cardiovascular risk and deaths are so high in the Wairoa area, we had no problems with our recruitment. But actually, when we went up to do about cervical cancer, we got no engagement, because they were part of the Tairawhiti botch up back in the day. Do you remember? I won't name and shame who the clinician was, but there was a big issue there about false positives and false negatives. And so actually nobody wanted to talk about that, but also the prevalence of deaths in that area really low. So it wasn't a priority for the community. And so I think understanding our skill base and what the community needs is really key on going forward. So you've been a little bit quiet out there, but in the audience, we've got one more question and then we'll go to lunch.
Kia ora koutou, I'm Tania Aho. I work in mental health, comprehensive mental health trained nurse. Has there been any research done into the system itself? We always understand Māori health is poor, still remains in that area. Has any studies been done on the systemic, where these key points, because in my eyes it's kind of like a bit of a housewife here. Yeah, things are quite simple in terms of a recipe. So somewhere in the system, key points of selection for Māori, where in that is getting missed, and is there research into the systemic failures?
Yes, I can send you some great papers later if you want. I think especially over the last decade, in using kaupapa Māori methodologies, we've shifted off the community and onto the structure and go, what's maintaining it?
Well, that's key.
Yeah, it is key. And Tracy Haitana's in the back, so yeah.
Got to go here.
Tracy, can you put your hand up? I'm not going to. So if you, if you look at Tracy, she's in the back. If you look at her, sorry, Tans, if you look at Trace, she can have a kōrero with you, because her whole PhD was on structural racism that leads to mental health outcomes. Yeah. 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 Mm. Yeah. Yeah. And these guys here have also got a lot of evidence on it. Yeah. Mm. Yeah. Structures are hide systems and norms though that maintain inequity. So yes. Okay. We'll send you some of our best friends' works because I don't think you want to read our stuff, but we've got cool mates that can send that out. Right. So what we're